Hi everyone, I am Dr. Nagarathinam, Senior Lecturer from Department of Conservative Dentistry and Endodontics. Today I am going to talk about stamp technique. Various filling materials has been used in dentistry to restore the last tooth structure. Among them, composite resin is most commonly used because of its superior aesthetics. Conventionally, the composite resin can be restored using a freehand technique. That is, a small increment of resin is placed over the prepared cavity and give shape to it. However, that is very technique sensitive and time consuming. And it is really difficult to achieve a precise occlusal anatomy with a freehand technique. It is just like the sculptor meticulously sculpting the sculpture. Bringing back the occlusal anatomy using a freehand technique is highly depends on the artistic skills of the clinicians. In addition, it needs more time to finish the restoration to get a proper occlusion. So to overcome this, a stamp technique has been introduced by Dr. Wasim Riaz. In this technique, a custom-made stamp of the occlusal surface can be prepared using a flowable composite and a microbrush. However, this technique only be used in initial patent-efficient caries lesion without any cavitation. And apart from the conventional armamentarium used in composite resin, in this technique, we need simple three materials, that is flowable composite, microbrush, and Teflon tape. Let's see the clinical steps. The first step is the flowable material is injected onto the entire occlusal surface and the microbrush is placed over it with a gentle digital pressure, and then this is light cured for 20 seconds. This procedure should be done without application of bonding agent. The next step is we have to gently remove the stamp from the occlusal surface using a probe. Keep in mind, don't injure the adjacent tooth soft tissues. Next step is caries excavation. It is done using aerator and round bar, followed by the application of acid etchant. This is done to increase the surface area and to create microporosities on the prepared tooth. It is then rinsed with distilled water and blow dried using gauze. The next step is application of the adhesive using microtip. It is then light cured for 20 seconds. The next step is placement of restorative material in the prepared cavity. For that, small increment of composite is taken using a hand instrument and placed against the walls and floors of the cavity. And it is light cured for 20 seconds. The final increment of the composite is placed. Just adapt the composite against the walls of the cavity. Following this, a Teflon tape is cut into small piece. This is the Teflon tape. This can be cut in a small piece and placed over the composite. Properly adapt the Teflon tape over the occlusal surface. On top of this, place the custom-made stamp which we have got preoperatively. Just give a gentle pressure using tweezer. And then remove the Teflon tape carefully, and the excess material can be removed using hand instruments. And then it is light cured, finally light cured for 20 seconds. So with this simple technique, we can get the previous occlusal anatomy post-operatively. I would like to thank Dr. Prem Kumar and Dr. Sai Vignesh for the videography. Thank you, everyone.